Loveline, yes it is. Phone numbers 1-800-LOVE, 191, 1-800-568-3191. Fax number 310-854-4455. This is Adam Carolla. That is Dr. Drew. He's a board-certified physician and addiction medicine specialist.
And it's Valentine's Day.
It certainly is. And let me tell you what I think Valentine's Day essentially has turned into.
For you?
No, for man in general.
All right, I'm ready.
It is turned into a religious holiday for men to atone for their sins. Basically, like Yom Kippur is for the Jews.
Yes, yes.
That's what this is. It's a day of atonement because we've been a-holes the other 364 days out of the year. We've not done right. We have not bought the flowers. We have not done the surprises. We have not been spontaneous. We have not made the effort.
Until tonight.
Right. And this is the one chance. Actually, this and the birthday.
Yeah.
But this especially.
Yeah.
You have to come through tonight.
Right.
And tonight we have a very special guest. We have.
You got the most amazing grin tonight.
We have.
You're like almost drooling in anticipation.
I am like a shark staring at the chum bucket.
I really do feel kind of fearful tonight for some reason.
Not that your lovely wife Susan is in any way close to a chum bucket. But I'm saying I am that excited. I'm on the edge of my...
bucket.
You're the chump bucket tonight. We are bringing Susan Drew in. Mrs. Drew.
Right.
Nancy Drew. No, we're bringing Susan. That's Drew's love. Now, how long you guys been married?
5 years this July.
She was the bearer of your triple seed.
That's right.
She carried around 3 kids.
That's right.
That is love, my friend.
Yes.
And let me tell you, sprung right back into shape like some sort of cartoon character. Fit is a fiddle, this girl. Svelte.
Yes, svelte.
Yes.
Somebody else called her that tonight. Did you tell him that? Yeah, okay.
Very attractive.
Yeah.
And I mean that with all the respect I can muster.
Thank you.
Just...
Now you're done. Now what's going to happen the rest of the night?
I am going to dig into her.
I'm sure
I am going to shake her down like Joe Friday. I am going to sweat her like it's the Nuremberg
and
trial.
By the way, I enjoyed meeting your date tonight.
Well, let me tell you what happened with my date.
Oh, okay, yeah.
I have been going out with someone for a short period of time. She's not a big talker, and actually I enjoy that.
Did you atone today?
I did. I was pretty good, but we're going to really celebrate on Friday. Because tonight we just had a little dinner. Mm-hmm. Now, what we tried to do with me is we tried to line up an old girlfriend of mine to come on the show.
Right.
She would have no part of that.
Somebody who would speak honestly about you.
Yeah, because this new girl I've been going out with just a few weeks has no dirt on me yet.
Right. At least she doesn't see it.
Right. The dirt is not rubbed off onto her yet.
Right.
But, Lord knows it's coming too. But the point is we had Cynthia, my old girlfriend, who I'd gone out with for almost 2 years, who could have come in here and just crucified me.
I was looking for that chum bucket.
You would have been elated. But the point is she could not make it in because her new boyfriend would have none of that, and that's how guys are. He claimed that he had something special planned. But as any guy will tell you, that is a big load of crap. He didn't want her coming in and spilling the beans. And that's basically it. Second choice was me trying to get a girl who was on the cover of a raft. Now, this story takes a little explain, but I go into the Big Five Sporting Goods and have been for the last 10 years. And each time I go in, no matter what I'm going in for, I walk straight to the raft section, the pool float section. Yeah. And I grab this box because there's the greatest looking girl in the world floating around. You know, they're smart. They don't put like postmenopausal chicks with thyroid problems on the raft. They want to sell rafts. Yeah. They put great-looking brunettes and blondes and leggy and tan.
And you were going to meet this girl. How?
I would just stare at this box.
But you wanted to meet her for today. In 24 hours, you're going to come up with her. How?
I know. We couldn't find her. She moved to Hawaii.
Imagine that.
So that was it. Then we tried to get Adrienne Barbeau. She would have none of us. So the point is I'm dateless, but it's okay because we can grill Susan, and she's going to come in here in about 5 minutes. But first, we're going to the phones. Gail.
Yes.
You're on Loveline.
I have a question for Dr. Drew.
Yeah, Gail.
I was diagnosed with dysplasia of the cervix, and then I had, excuse me, I had a colposcopy done, and then I had a LEEP procedure done.
Which kind?
A LEEP procedure. And after going back in for my 6-month exam after that, my pap smear came back abnormal again.
You have a cone?
And I want to know what my...
Are they going to do a cone biopsy?
We haven't discussed that.
Yeah.
What is dysplasia?
It's sort of pre-cancer. It's why you get pap smears, to find that stuff, go after it, get it freezed off or burned off or cut off. So you don't get cancer?
Before it becomes cancer.
Before it becomes cancer. Just like if you had a skin thing that was looking like it was become cancer.
Like a mole or something.
A mole that looked bad, you take it off, it's gone.
Okay.
That's the good news about cervical dysplasia. When it's gone, it's done. But it does tend to recur. And the more procedures that are done to your cervix, the more potential there is for there to be problems with what's called cervical incompetence. I mean, cervix has trouble really holding the baby in the uterus. But I wouldn't think it'd be much with what you've had so far. I mean, this is really common, what you've had done. Real common.
Even after having the LEAP procedure, it came back on my Pap smear as severe dysplasia.
I didn't say that. I said what you've had done so far is very common.
Okay.
The fact that you had it done again, I don't know, I wonder if they're going to do something more to you. And that, of course, increases the probability.
They said they couldn't do the LEAP procedure again for another 2 years. And I just want to know what my chances are, or what the odds are of it possibly turning into cervical cancer. Or
I can't give you an exact number, but there's a real probability of that. So I'm sure they're going to do something to take care of it. Okay. But and again, I don't think your risk of fertility problems, if that's what your question is going to be that great. Okay.
Okay. Thank you.
Good luck, Gail. So you're saying they found it, and they're going to keep on top of it now.
Yeah, she's going to be fine. But she's worried about her fertility issues. Those are real concerns, but I bet they won't be.
And they got all kinds of stuff going on these days, right?
Yeah.
I mean, you and Susan had some
stuff,
right?
Oh, absolutely. We're for a slam dunk in a fertility campaign.
Right. I mean, 20 years ago, would you have been able to utilize this technology?
No.
Was it in place?
No.
Right. So 20 years from now, don't you think we'll be able to just...
Yeah. Oh, it's still moving forward. Absolutely.
Yeah, that's why I'm freezing my sperm as we speak. Sabrina.
Hi. Hello, Adam and Dr. Drew.
Hello.
Happy Valentine's Day.
Happy Valentine's Day.
I have a question and sort of a problem. I love to masturbate. I do it all the time. But lately, when I masturbate, I can't orgasm. I mean, I can orgasm when I'm having sex with my boyfriend, but I can't do it on my own. I was just wondering what I could do.
How old are you?
16.
Ann, producer Ann. Attention, calling Dr. Flambe. Ann, get on the horn here and tell young Sabrina she's having difficulty with her masturbatory.
Are you on any medications?
Just stuff for my arthritis.
What?
There's some stuff called Daypro.
Yeah.
I'm on Vicodin.
Oh, well, that's Vicodin. Why are you taking Vicodin?
I have a rare case of arthritis.
What kind?
HLH B27.
What kind of B27 arthritis?
Ankylosing spondylitis.
Ankylosing spondylitis.
B27 Liberator, won World War II for us.
It's a seronegative spondylarthropathy called ankylosing spondylitis. You're kind of young to get that diagnosis. It usually doesn't start until later. But I will tell you what, the reason you're having a problem is because you're on Vicodin. It's a strong opiate. Do not take that. The Daypro could cause problems too, but the opiate is definitely going to cause problems.
But she's able to reach orgasm with her boyfriend, which is kind of strange, isn't it?
But whatever it is that the pharmacology is doing to her has caused this side effect. And if she goes off the drugs, she'll go back to her normal state. You're a big believer in the exact, pristine environment and circumstance for this behavior, right?
I certainly am.
Right? Okay.
Yes.
So she has fouled that circumstance. She has soiled it in some way.
You've made a mockery of the whole masturbatory shrine that I've built over the months here at Loveline. All right, so clean up. Get off the Vicodin and get back on the stick.
And there are a number of there are a lot of other treatments for AS too. So try to avoid. Yeah. Go see a rheumatologist. Okay.
I've seen 3 of them.
You
put me on the same thing.
Yeah, look at them. No better than pushers. No better than street pushers, these guys, Drew.
Do you know what ankylosing spondylitis is?
Yes, I do. As a matter of fact, I lived with it for years. I watched my dad crumble up like an old leaf and die in front of me. Do you know the pain of that? No.
Neither do you.
No, I have no idea. But Drew, really showing off for the ladies tonight, I notice.
Why?
You're really on top of your game.
They're giving me good questions.
I know, but I think your wife being here sort of...
Is that good?
Yeah, I mean, like a lot of guys would like... What I mean is you're doing what you do even better.
Okay.
Meaning, like, if my lady were here, I'd like masturbate even more or something. You know what I mean? I would do what I do.
Right.
I would drink even more coffee. I would pass even more gas.
Yes, it would be a lovely event.
But you're throwing even more confusing jargon into the mix. Jay, you're on Loveline.
Yeah, Dr. Drew.
Yeah.
Got a question for you.
Yeah?
Past couple days, my girlfriend's been kind of dry, And then just today, it's kind of hurt her when we had sex. And today I noticed that my penis was a little, like, dry and flaky.
Right.
And she didn't want to, do anything. I said that was fine because she couldn't get wet at all. Okay. Really. So, and then that kind of ruined the whole Valentine's deal. So.
How's your relationship going?
It was going pretty good. It's been a little over a year.
She on any medication?
No, she's on the pill.
Mm-hmm.
No,
but
I don't know.
Just the last couple of days, she's noticed that it's been kind of dry. It was after she got over her period.
I don't know what it could be. I mean, you obviously got to give her a chance to heal. I mean, give her a chance to cool out. If you both have been irritated by this thing, don't be so obsessed about it. Use lubricant if you need it. And if she continues to have this problem, get her a doctor. I mean, it could be related to the pill, could be something else, but I bet it's something that just kind of goes away. And it could be that there's an emotional thing going on.
Right.
In their relationship.
That's your libido affects the moisture factor. Am I right?
Right. And your comfort and your feelings.
Right. So if she's feeling a little down or something, wouldn't that affect that?
Absolutely.
It'd be like a drought, right?
A drought, exactly.
There is something because it's like flaky and.
Well, that's just that's you. Don't worry about that. But
okay.
But worry about what's going on with her. Try to get her to open up and see if there's anything that's really troubling her. Okay.
Okay. One more question.
Yeah.
When does your TV show start?
It starts in the fall.
Okay, and do you know what channel or?
Fox.
Fox
out in Fox.
If you have Fox, it'll be
wherever
on Fox.
that is. I think we're on like 10.5. Yeah. We'll be between two channels. Thanks for asking, Jay.
Yeah. Thanks.
Well, look who just rolled into the studio, looking lovelier than ever, I must say. Susan.
Good evening, Adam. Good evening, Drew.
Susan's, I almost said son. That would have been a big son of your father, and wife of famed Dr. Drew. What is it like?
Well, it's quite impressive.
It
actually
is. I mean, he's a catch.
He is. It's really amazing being married to him because, anywhere I go with him, I feel like the luckiest girl in the room.
I feel that way every night when I show up to work.
You didn't tell me that Valentine's Day was atonement for wife also.
We are going to build you up like a house of cards before we mow you down, Drew.
I'm waiting.
And so let me continue on with the praise of Drew. Drew, for a lot of people that don't know because they just hear his voice, is not what you'd picture. Like when a lot of people picture a doctor, they picture like, sort of Einstein hair and, the dad from the Happy Days type of physique and maybe a bad chain and maybe, very unkempt, with the hair coming out of the ears and the nostrils and stuff. Maybe like a bad beard with some dried egg or something in it constantly that everyone's scared to talk to him about. Drew is quite a figure of a man. He's at least 6'2".
If anything, I want to be dominated. Wait.
He's into all sorts of kinky stuff.
Come on, Mike.
He's solid as a rock. He's forged from cobalt steel. He's an attractive guy. I mean, he really is. And you made the catch of the century.
I certainly did.
Now, okay, tell us where you met.
We met on the air.
The radio.
In 19...
You already were on to her?
Lurking about, yeah.
Oh, really? Drew, doing some stalking.
I wrote a chapter in your book.
Where did you see Susan?
Mutual friends.
Oh, okay. Now, did you...
Strangely, if you really want to get into this, strangely enough, we had run each other at a club 2 years before that, or 3 years before that.
Oh, you were cocktailing at a gay bar.
No. And the same thing happened where I don't go up and talk to people, but I felt like I really had to talk to this person. I can't even explain to you what this was. And
boner?
And had the same experience again. We were dating and didn't even realize it was the same person until we've been dating about 6 months.
And he saw a picture of me
that night and said, wait, you were there that night? And so
I said, yes.
All right, so he walked right up to you at a bar?
Well,
is that
he called me over to his table and said...
I didn't have to No, I walked right up to you.
Is he Don
You
Corleone?
walked up to me. Okay, maybe so.
Called you over to his table.
I thought that was...
You shouldn't remember who it was that night. Forget it.
All right,
I blew him off. I barely remember.
Right, but he asked you out on that evening.
I just tried to talk to her, and I was just like...
All right. She gave him the big. Well, she's a beautiful woman. She's used to guys coming up and talking to her, and she's in that mode. Now, where'd you go on the first date?
We went to a little bistro in Laguna Beach, and then we went to that Mexican place, Las Brisas, for a drink afterward.
All Laguna.
Mm-hmm. So this is 84 now, so he's wearing a leather members-only jacket, an afro.
No, he looked about the same as he does today, actually.
Some Capizio dance shoes, perhaps.
Button down, and maybe a tie.
Looking stiff.
Oh, he looked
You thought he was a little uptight when you first met him?
She's known that ever since.
Was he giving you this whole big medical rap, or where were you in 84? You'd already...
Just finished.
Okay, was he giving you, relax, baby, I'm a doctor? Did he work that line?
Nobody sang opera to me from Newport to Laguna.
That's right.
It was
a
quite
little-known
romantic.
fact about Dr. Drew is he is an accomplished opera singer.
I told him
amazing.
he was flat, though.
Shout out one note, Drew.
No.
Come on.
No, this is tough enough for me to sit through this.
Just one la done mobile.
No, someday.
Okay. All right. So you went out.
His music charmed me, quite honestly.
And you hit it off on the first date?
Very well.
You knew you wanted seconds.
Certainly.
Right. All right. Now, let's get to some more hard-hitting questions. What kind of underwear does Drew wear? The briefs or is it the boxers?
Well, it's a combination.
Okay. All right. I'm marking that because I got a list
Whatever
here.
she buys me.
Has Drew ever broken wind during the act?
No.
Never? Come on.
Never.
One time?
Never. Just
once?
Never.
But you heard him go to the bathroom and do something like that, right?
Never.
I can see this is going to be tough. Has he ever gotten drunk and vomited on you? He did, didn't he?
Well...
Yes. Okay. I'm taking that. I'm writing yes down. If you're keeping score at home, that would be a big Y.
No, I have to explain. And
yes, he did. Yeah. What's he doing? What are you doing? He's doing a semaphore in the background, like he's on a carrier deck. Put your hands down, Drew.
And as a resident and an intern in his training, he was under a lot of pressure, and he had an ulcer. And I'd take him out, and I'd make him eat garlic and drink wine, and then the poor guy, he had a real rough time.
Now, where did he vomit? Was it on you?
No.
Yes.
No, it was usually like 2 or 3 in the morning. He'd wake up, and he'd have his ulcer would flare up, and it was terrible. I felt really bad.
But he never soiled you,
I had no sympathy
per se.
for him, but, I'm sorry?
He never vomited on you?
Never.
Okay,
no.
So we'll give him like half a point.
It was never a drunken stupor, He just had a bad tummy.
Does he ever get nuts and play air guitar in his underwear or anything like that? Come on, he's nuts.
No, only when I'm out of the house, I'm sure.
Oh, okay. So that we can't substantiate that. All right, let's go to a call real fast before we go to break.
Can I answer a question on the last caller?
Yeah, go ahead.
I think maybe the problem could be this. Since I am a woman,
this is the dry
I may
thing.
have experienced this.
Right.
Hypothetically.
After your period.
Right.
You've used plenty of tampons, usually.
Right.
And they dry you out.
Right.
And the day after, it's very uncomfortable to have sex. It doesn't lubricate sometimes.
Right. Because you've mopped up, so to speak.
Yes. And you've lost all your moisture in there. And sometimes you will have, changed your tampon so many times that it gets really sore and dry in there.
Okay, so
that's a woman's point of view.
Right. Well, no, I was going to say that, but I'd never changed my tampon. Sandy?
Okay.
Yeah.
You're on Loveline?
Adam, Susan?
Sandy?
Okay, my question, it's not really a problem, but kind of. Okay, I was dating this guy from July to January. He moved to Colorado in January. He then is coming back this weekend just to see me. And I want to know, how should I greet him?
Nude? Susan?
Other than that.
Susan, what you're a woman. We established that with the tampon story, the lengthy tampon story. So tell us, how should she greet him? How would you greet Drew if he was out of town for a while and coming home?
Here are the kids.
Really, it's about time you're home.
Let's say the kids are gone, and it's a weekend, and he doesn't have to work the next day.
Well, I'd make sure that I made a nice dinner.
Well, he's not landing until 2:10 Saturday morning.
Okay. All right. So we're into dessert or cocktails or what have you.
So
Well, you could probably just, I guess it's 2:10 in the morning. Are you ready to be dressed for bed, or are you that far in your relationship?
Yeah.
Well, then just, have something really nice on when he gets there and greet him with a nice big hug and a kiss. Sit down. Maybe, if he needs to relax a little bit, maybe give him something to drink or eat. He probably won't want anything if he's been on an airplane.
No, massage. You've tapped into it. Give him a rub down.
Yeah, a massage or a hot bath or something.
Heat the oil, put it in the microwave, put a little scent, burn a little incense, put on a little yanni or something, and give this guy a rub down, and then, of course, have sex. Phone numbers for Loveline, 1-800-LOVE-191, 1-800-568-3191. Fax number, 310-854-4455. I'm Adam Carolla. We have, as usual, Dr. Drew, and as unper usual, we have his lovely wife,
for Valentine's
Susan, for Valentine's Day.
For my atonement.
Who I've been picking at like a miner, trying to get dirt. I'm mining you, but you're like a dry well.
I'm sorry, he's perfect.
I know that, and the listeners know that, and that's why you're here. Because we are trying to unmask Drew. We're trying to find the dark side. Like, he beats the kids a little bit, doesn't he?
No, there's nothing wrong with him.
Okay, you understand I have to ask these questions.
Perfect.
All right, let's not work this angle for too much longer.
She mentioned she had some questions for you, though.
Oh, she does. Oh, were you guys talking?
No, she didn't tell me what they were.
I'll get to those later.
No, feel free.
Well, no, I don't really have questions, but I will.
The one thing about Susan is she does not sit in the back seat and let Drew put on the dungarees and drive her around this life. She has a lot of opinions. Like, for instance, she just got done telling me that last night's show sucked.
Yes, right. And asked what you'd done to abuse Nev Campbell.
What I did to Nev Campbell.
Yes.
Last night's show was there was a weird energy.
There certainly was.
We cannot come up to the plate and hit home runs every time. Once in a while you foul one off your groin, and that's what happened last night, but I acknowledged it, and I tried like hell to pull the thing back on track, but we just couldn't do it.
Yes, it was.
Was it that painfully bad?
It was sad. A lot of the calls were very repetitive, and I've decided that you need to have a disclaimer tape at the beginning of every show, and that would be something that would inform most of the male listeners that masturbation is not harmful, and that so many times a week will not hurt your health. So please don't call with this question because we've heard it 100 times.
You're right. I was actually thinking about that today. I was not touching myself, by the way. It was just happened to pop into my mind, and I was thinking we do not need another damn call where someone's saying, I masturbate 4 times a week.
I mean,
is that
it's a
problem?
great question, but, the female listeners are probably tired of hearing it.
I don't know. I would, as a male, would enjoy hearing women go off and drone on endlessly about masturbation, but that could be me.
Well, but you don't want to hear us.
And I'm a fan, so I'm interested in it, but it's, I understand. And point well taken, okay? We won't do that anymore. Ryan.
Yeah.
You're on Loveline.
All right, man. Like when you're looking in the back of pornos and stuff?
Mm-hmm.
Those ads for the penis pump?
Mm-hmm.
Okay, I'm wondering, because, of course, every male wants a large penis, but the thought of pumping up my penis did not necessarily entice me. So, what's up with those? Do they work? Or?
The ones that say enlarge your penis to mammoth proportions?
I'm looking at a foot and a half.
Oh, boy.
Mammoth proportions.
You don't want
Woolly
it to be
mammoth.
that big.
No, I don't want mammoth proportions.
Well,
No.
I do. I'm asking the question. Is it harmful?
Well, no, it's not harmful. You know it works, though, because they show... I'll tell you how you know. They show a picture of a guy limp, and then they show the same guy with a boner.
Right.
So you know that his penis has been enlarged at least 2.5 times.
Well, you know he got an erection, but you don't know that... I want the guy with the erection, and then after he uses the pump with the same erection.
All right. I swear to God, I have heard people claim that these things do something. Drew says no.
I don't know.
I think you've tried it.
You think I've tried it?
That's how you know.
You think I...
Don't you have to have it surgically implanted?
Well, the pump's so easy. It's like $29.95, They send it to you.
Yeah, not the internal pump, not the bladder, Susan.
No, the one where you put on...
It's like a vacuum.
Right. Here is my take on the whole...
Right. Right.
Here's my take on the whole pump thing.
Yeah.
Worst case scenario, it feels good. Do you know what I mean?
But it's like a pressure. Couldn't it like explode or something? You know?
Well, then
it's like a vacuum in there or something.
Listen, those things are. They say they come with a guarantee, don't they?
Yeah, but I mean, if my penis explodes, how are they gonna guarantee that?
Ryan, listen.
It won't explode.
Yes.
All right.
But it won't work either.
Millions of.
Okay, that's all I want to know. Because I don't want to waste $30 for nothing.
This has been proven on countless numbers of morons across the country. Your penis will not explode.
Magic wand makes my penis grow.
I say test it out and call us back.
Well, that's $30 down the drain.
I think you're wasting your money.
You're saying your penis is not worth $30, Ryan?
Well, it's all right now, It's a good 6 to 7 inches, but...
It's fine.
It's fine? Okay,
perfect. That's perfect.
I got one more question for Dr. Drew.
Ryan.
Okay, yeah.
Your questions are quite stimulating.
Okay, thanks, man.
Yeah, what's up?
I'm in college, so of course...
Imagine that.
Yeah.
What are you, in Barber College?
No, we're... Okay, so we drink a lot down here,
Imagine that.
Yeah, but I was thinking of changing to marijuana.
Beautiful.
Well, because it's a little more under control, You
no.
Don't get crazy. I mean, you just sit there. You don't get crazy.
Yeah.
You don't forget stuff.
Right.
What would you recommend, friend?
I would recommend you...
Neither?
Well, it sounds like you have a family history of alcoholism, and so you have momentum with that drug, and you're going to...
No, none of my parents drink.
Your grandparents?
No.
No, they all died of cirrhosis.
Right.
Of the liver.
What's your ethnic background?
German.
Okay. I would suggest that you at least try to cut back on alcohol. Don't try switching to something else. If you're not an alcoholic, you should have no trouble cutting back.
Well, no. You see what I'm saying? I drink about 1/4 amount that people here drink.
Look, I'm just telling you that pot chronically used has a lot of potentially damaging effects that are more serious, I think, than moderate
Ryan,
alcohol.
listen, concentrate on your penis size, would you? And stop bouncing around topically that way. You know what Ryan needs? There should be some invention, combination penis suction device and bong. That, you could move some units of that. It's a long cylinder. All you just have to do is put like a carb on the side of it, and I think you could work something out. I'm going to look into that.
That's the other thing.
I have a question for you.
Yes.
Are men addicted to their penises?
Yes.
I mean, they sell these pumps in order to make money off of men who are addicted to penises.
Right.
And, this guy's asking if he should go from alcohol to alcohol to pot to his penis. I mean, it's like, come on.
Yeah, no, they are. Well, you have a young son.
But for $30,
2 sons.
You can improve your masturbation, basically.
Yeah, that's what it is.
Yeah. Basically.
And you could never return it because everyone would be too damn embarrassed. Sean.
Yeah, how you doing?
You're on Loveline.
Yeah, okay, there's a girl that I know, okay? I've been seeing her for about 4 or 5 months now, and I like her. I mean, I'll tell you the truth, I love her. I've never told her that, but, because we're kind of, we don't say it to each other. We write it down on notes or whatever.
Right.
And
tap it out in Morse code.
Yeah.
God forbid she should know she's loved.
How would I tell her that I love her? Because
it's the first time he's ever told this to somebody.
You've never told it to anybody?
No, I told it to somebody, but I mean not her. I mean I really like this girl a lot.
How was it the last time you told somebody that?
Oh, how long ago was it?
How was that?
It was a good feeling.
Was that really somebody you really did love? Or you just kind of
Yeah.
And why are you having trouble telling this girl that?
Because I'm scared. I like this girl more than anybody I've ever did.
And what is it you're afraid of? That if you tell her...
I don't want to scare her off or,
So you might frighten her. What else?
Yeah, that's what I'm afraid she'll, not talk to me.
So it's a risk you might lose her if she knows your true feelings.
Yeah.
You don't do it while you're having sex, by the way, because she won't believe that.
Yeah.
I think you just have to sort of come out with it.
Yeah.
But, Susan, what do you think? When did Drew tell you he first loved you? When he was sober.
I don't know. Do you remember? I don't remember if you ever did.
You don't know where you were when Drew first said those 3 magic words?
Well, not really.
Uh-oh, she's in trouble.
What is that?
When did he doesn't remember either.
Drew, of course he remembers. He comes in, he has pictures of it. This is pathetic. You don't know where you were? You on the beach somewhere, perhaps, at a restaurant? Could you make something up? This is horrible radio.
I remember him telling me he would actually he may consider marrying me once. That was about it. I remember we were in a limo and I was going to go off to Taiwan to do a modeling shoot, and he said, "Well, I would actually maybe consider marrying you." And I said, "Oh, great," and I got on the plane and left. But
I guess that's like saying he loved you.
I think it was just more of a natural thing. It happened. We didn't really make a big issue of it. But I think if you want to approach it in a nice way with somebody that you're worried about getting an adverse response from, just say, you know what, I think make it a nice environment where you're
like
alone.
Take her out to dinner.
Yeah, like go to the circus or something.
You know what, that's a little intense. Maybe like taking a walk on a beach or walking somewhere where you're not, face to face looking for a response from her face, and be having a casual chat with her and say, you know what, I just need to tell you that I think I'm in love with you. Don't say, you know what, I really love you.
All right, so don't say it like you need a response.
Say, first, I really liked you, and we've been really good friends, but I think I'm really falling in love with you, and wait for a response, but don't do it like face to face where you're going to be seeing what her face looks like, because she may respond and it may look differently than what she's actually
All right, so you're saying leave it open-ended. Don't say, I love you, do you love me?
Right.
Say, you know what, I think I love you. And
say, I'm really falling in love with you.
And don't pin her down and stare her right in the face and say it. Be walking on the beach, holding hands,
because then you're not going to read
stones.
into whatever her response is.
Right, all right. I love you. Make it comfortable.
Hi, this is Rodney Dangerfield. I tell you, the guys here at Loveline are the greatest. They're the best in the whole world. Now, will you please untie me?
Okay, Rodney. Phone numbers, 1-800-LOVE-191, 1-800-568-3191. Fax number 310-854-4455. This is Loveline. I'm Adam Carolla. That is Dr. Drew. He has been kind enough to bring his lovely wife, Susan, in tonight for Valentine's Day. They had a nice dinner.
We did.
You got a present. You want to open your present, Drew?
Is it time?
Oh, yes, please do.
It's always present time here at Loveline. And while you're opening the present, I want to continue my questioning for Susan. Susan.
This, by the way, is apparently something my mother was surprised at. Right?
Yes, your mother wrapped it, too, by the way. She goes, oh, don't tell him that. I said, is that kind of like saying that your mother wrapped it while you're having sex or something?
This is a gift you, Susan, bought for Dr. Drew.
Yes.
Oh.
There's a response. Hey! Boxing gloves. Wow, woman after my own heart.
Oh, yes.
In leather and everything.
Yes, that's so you can fight through the next year.
I know where you got. How many ounces are those? 16, 14?
I don't know. It was the only pair they had, so.
Oh, really?
Yeah.
Yes.
Are they okay?
Made in Mexico. Let me tell you, one of the few things that's okay to be made in Mexico besides tequila is boxing gloves. Yes, 12 ounces. These are lovely.
Really good.
Drew, you can do the rest of the show in your gloves. Now, that is a present.
Is it?
It certainly is. Guys aren't into, decoupage and stuff like that.
I thought it was a great idea.
Guys don't want mementos. Guys want stuff that's made out of leather that they can wear out.
Beat their wives up with.
There you go. He can work out some of that pent-up sexual hostility that he has toward me.
And me.
And we're going to get into that in a few minutes. But first, we're going to Vanessa. Vanessa, you're on Loveline.
Hi.
Hey.
I have a question for Dr. Drew.
Yeah.
Well, the other day my mom told me that I have something like an intact hymen.
Mm-hmm. Which is what you're supposed to have.
Well, I don't, because she told me, like, really weird. She was just like, when you were 6, he found it, and it was just a big thing. She didn't tell me.
When you were 6, she found it. You're supposed to have one.
I know, but now she told me that they're, like, going to have to cut it open with a knife or something.
No, oh, maybe you have a completely occluded hymen.
I have no idea.
Yeah. There is that. That is a potential problem.
Who found that, though?
My doctor. I don't know why.
Right. Some hymens have to actually be
Well, wait a minute. What's
perforated.
he looking for when she's 6?
I know.
Should he be looking around that?
Yeah.
Well, he said that I don't know. My mom told me that I have like a yeast infection or something. And go away.
Well, it's Mom.
That's Mom.
Go away. Go away. I'll do it later.
What kind of reverence is that you're treating your mother with? Is that your mother?
Yes.
You're shooing her like she's a pet.
Well, because you don't know. Because if anything, I know what she's probably doing in there in a second.
So what?
I know what she's going to probably do because her boyfriend lives with us now. So.
Okay, is that situation okay?
Yeah, I'm just trying to get her.
All right, let's
now.
get back to the hymen.
Okay.
What we're saying is that
that was a Frankie and Annette movie, by the way, from '67. Back to the hymen.
Vanessa, for instance, you've not had your period yet, right?
No.
And the problem is, if she has her period, it will not flow out because it is a complete. This is a complete membrane. We talked last night about there being a small opening, right?
Right.
Hers is completely occlusive.
So will it? Well,
has to be
come out like her ear or something, then, right? What'll
accumulate.
happen? It'll accumulate, and then it'll go bad, and then
you open it.
There'll be trouble. Yeah. You need to have like a tracheotomy done in your nether regions. Am I right?
Hymenotomy.
Hymenotomy. Could I do that?
When would this happen?
If you had the proper training. Probably not too distant future, frankly.
Because my mom, this is how she put it. If when I'm going to have intercourse with a boy, I will have to have it get and open up, and I will have to come to her for that.
Oh, no.
Oh, so Mom is using this like a chastity hymen.
So she's like, so she figures like when I'm 30 or something, I'll go to her and go.
No. When you have your first period, you're going to have it opened up. It doesn't have to be.
I think
when
that's
you
how it
have
works.
sex.
I mean, again, I'm.
Have you had a period yet? All right, so you may be able to turn the tables on Mom because Mom said you need to come to me when you're ready to have sex. Essentially.
Well, you're ready to have sex. Anytime, but when you're ready to get pregnant, you're going to have it.
Right, but Mom is holding this over her head, meaning if you went to your mom right now and said, I want to have this removed, she'd say, I think we'll give it another few years.
I think your doctor should decide.
Right, you got to talk to your doctor about
it. I was supposed to this Friday, except
right.
he canceled.
Well, it's not an urgent thing, but get in there and get it taken care of, okay?
Well, because she said that if I wanted to have sex with a boy, I would pass out in pain.
Yeah, it's possible.
Oh, Mom, is she a religious woman?
No, not at all.
Well,
really?
Because there's
pretty crafty.
But don't worry about that. Just get with the doctor. Get a plan together with the doctor. Don't worry about how your mom is dealing with this with you. It's not a big deal. Get it taken care of.
And
she's instilling.
I have to be honest with you. My dad tried this same maneuver.
On you.
He kept my testicles in his sock drawer until I was 17.
Imagine that.
Do you believe that?
Yes.
He still has one of them.
No wonder you're so obsessed about them all the time.
I think he's using it for a keychain. I have to get it back. Mike.
Hey, how's it going?
Good. How you doing?
I'm all right.
Good.
I've been going out with this chick for 6 months, and I haven't talked to her in the past week. I don't know why, and I only see her on weekends because she lives, not too far, but 20 miles,
Mm-hmm.
And I just haven't been talking to her, and I don't know why. And I really want to fix things, but, if I call her up right now, what am I going to say? Hey, how's it going or something?
Forget about what you're going to say. What am I going to say when I sweet talk her back into your life, Mike?
It's Valentine's Day. It's good night to do that.
Yes. I'm putting on my Cupid diaper. And what is that, by the way, Cupid? Isn't he wearing a diaper?
Something like that.
We have an incontinent angel of love. What the hell is that? What was whoever dressed Cupid thinking? I want to see a guy dressed like a pimp.
He's a cherub.
But he's not a guy. He's like a little infant.
He's a cherub.
A cherub?
Yes.
No, I want to see a guy like in a fedora with like a leopard skin, overcoat on. Some guy looked like a Huggy Bear from Starsky and Hutch.
Mike, is that all right?
Sure, yeah.
Yeah,
all
let's
right.
call her. So, all right, Mike, we're going to put you on hold. We're going to get her number, and I'm going to patch everything up between you two. And Susan's going to help me out because sometimes relationship needs a woman's touch. Am I right?
Oh, gosh.
Yeah, you're going to help. Chris.
Hi, Adam. How's it going?
Good. How you doing?
I'm doing good. Hi, Dr. Drew, and hi, Susan.
Hey, Chris.
Hello.
What's up?
Okay, I just want to start off by explaining I have a friend who's been investigating becoming a dominatrix.
Yeah.
And she was told that she might have to get involved in transvestite training. And we're just wondering what transvestite training is.
Is that like transsexual training?
No, it was explained as transvestite training.
Oh, yeah. You got to go through strap camp, which is like boot camp, except for it just goes up your crack there. There's all sorts of things that are involved with that. It's a lot like the military.
Go ahead. Wherever you're going with that, Adam, you just go ahead.
You want me to keep going?
Well, you want me to stop you?
I'd like to turn it over to Susan and ask if Drew's ever asked to be beaten.
No.
Never?
No, and I know nothing of this sort of thing.
Even when he's been really naughty?
Yes. No.
He never wants you to, he never calls you mommy in bed?
No.
Somebody spank me.
Chris.
Yes?
Chris, I suspect they're talking about transsexual training, the people who are going to change sexes operatively, they're going to have an operation that take them from man to woman or back, have to go through a period of time where they live their life as that sex before they have the operation.
That's amazing.
Yeah, for like a couple of years usually with a lot of intensive therapy and evaluation stuff.
Put them in a room, they watch ESPN2 and drink beer and make fun of women for an entire year.
In other words, we have no clue, okay?
Yeah, because where I was confused is what does that have to do with being a dominatrix?
I don't know. Well, who was telling her that?
Well, transvestites dress up, right?
Is there
so
dominatrix?
The adult shots, and
you
there
have
was this woman there who did it.
Well, look,
you probably learn how to dress up in all this weird garb and get yourself.
But we're talking about somebody that's going to dominatrix training school. I mean, what?
Well, I would imagine. Well, listen. All right, let me say this.
Sort of like travel agency school, Drew.
I used to teach comedy traffic school,
right?
And I had to go through an extensive training period because the company I worked for did not want me getting up there and making an ass of myself, which I ultimately did.
Of course.
But first, I had to go through the training,
just like the training you had before getting on this show. Extensive,
right? Carpentry and boxing. The point is if you're going to employ somebody to be a dominatrix, you should probably tell them what you want, some of the policies.
Yes.
How to handle a cat of nine tails.
Right.
How to verbally abuse someone. How to shackle someone. How to beat somebody. When to stop beating someone.
All right, we got that.
I'm starting to get excited. I don't know if you noticed that.
I'm sure they weren't going to stop, were you?
Transsexual training. Yeah, right, Drew.
You're helping on this one, Sue. Jamie, you're on Loveline.
Hi, I had a question about piercings.
Yeah.
Mm-hmm.
I just pierced my lip like 2 weeks ago, and I was wondering when it would somewhat heal more.
I would think it would have healed by now.
You did it yourself?
Yeah.
Not a great idea.
What'd you use?
A sterilized needle.
How did you sterilize it? You have
I burned it and
you have an autoclave at home?
Outside for a long time. And
yeah, Jamie, that is just an uncool thing to be.
Well, I didn't trust anybody else to do it because I'd had my friend who had gotten it done, and they had pierced one side of his lip, and they had trouble getting the earring in or the lip ring in, so they had to do the other side too, and his lip got so swollen.
Well, look,
how old are you, Jamie?
14.
Where do people get the intestinal fortitude at 14 to take a needle and push it? I mean, I pop a zit on my side and I'm screaming bloody murder and laid up for weeks. How do you take a pin and push it straight through your lip?
Yeah, it's ridiculous.
It doesn't really hurt that much. It's just after a while it gets really, really hard because the skin gets thick, and so you're like, ah.
All right, Drew, real fast, tell her what to do.
If it's more than 2, is there any drainage from it?
Yeah.
Yeah, I mean, it's either rejecting or getting infected. You could have a real mess in your hands. I mean, if a true infection sets up in that area, a head and neck infection can be devastating. And I suggest you have a doctor take a look at it, make sure you're using the proper cleaning solutions, talk to a piercing organization, see what they do in terms of their aftercare. It turns out, as I understand it, the aftercare after the piercing, if you've survived it, you don't have any bleeding or any problems structurally, that the aftercare and care of the piercing is really what's critically important.
Okay.
So there.
And when we come back, we're really going to put the screws, pardon the pun, to Doc Drew and Susan, and I'm going to dig up some dirt, or my name is not Mike the engineer. Oh, we are back on Loveline. 1-800-LOVE-191 is the phone number. 310-854-4455 is the fax number. And we were talking a little earlier to Brother Mike, who was having some difficulty in a long-distance relationship, if memory serves. And we said we would talk to his significant other, who is named Amanda. Amanda?
Yeah?
What's going on? You're on Loveline.
Hi. I don't know. He hasn't called me for a whole week, so ask him what's going on.
He doesn't know. That's part of the problem here.
All right, we're seeing Mike, can you hear me?
Yes.
All right. Amanda, can you hear me?
Mm-hmm.
It's Valentine's Day, kiddies.
Mm-hmm.
What is going on?
I don't know.
I feel like a moron.
What?
I feel like a moron.
Why haven't you called her in a week, Mike?
Yeah, that's what I want to know.
I don't know. I'm stupid.
And once you did, and you probably got too nervous and anxious about doing it, and guilty.
Oh, you guys, I have another call.
Well, screw them. You're on Loveline. And you know it's not Mike.
No.
Who would it be?
Oh.
It's probably my friend, Alyssa.
Don't get it.
Okay, I won't.
Listen, Mike.
Yeah.
Why did you call us and complain that the relationship wasn't working, that you haven't spoke to her in a week when it was you?
That's what I said. I'm a moron. I sabotaged it.
What are you thinking?
I don't know.
You scared that you're getting too close?
Well, yeah, kind of.
You scared that you have feelings that are too strong?
Yeah.
Why don't you tell Amanda how you feel right now?
I feel like a moron.
No. We know you're a moron, but how do you feel toward Amanda?
I love her. I love her with all my heart.
All your heart. Amanda, do you hear that?
Mm-hmm.
What do you think of Mike?
I love him too.
Oh, God.
Amanda, say, Mike, I love you.
Oh, Mike, I love you.
Love you too.
Okay, all right, Amanda, do it right. And you too, Mike.
I'm doing it right.
Amanda, tell him you love him and tell him like you're dying.
I love you.
I love you too, Amanda.
Now everybody knows.
I believe Mike more than I believe Amanda.
Yeah, Amanda, you are not going to win any Oscars for this performance. Amanda, do you really love Mike?
Yes, I do. There's just, we need to sort something
She's angry.
out.
She's too mad.
Are you angry at him?
Kind of, yeah.
Do you feel...
Well, it's Valentine's Day.
I know, but...
No, you're mad because it's Valentine's Day.
Well, yeah, that, but I've been mad for a while.
What happened? Why?
Just this whole week.
This thing of him not calling.
Yeah, and him hanging up on me and...
All right, wait a minute. We're going to get to the bottom of this in 10 seconds. Okay, now when we left off, we were talking to Amanda. Amanda?
Yes.
Mike's still on the line.
Mike is on the line, but Mike cannot hear you right now.
Okay.
Let's talk for just 1 second. What's really going on? Because I didn't buy that I love you crap for a second.
I mean, I love him. I still care for him. It's just the week that he didn't call me kind of showed that he really didn't care for me. And it kind of bothered me. And it didn't really lose it. A little bit, maybe it did. But it's just the way he showed it was like he didn't care, and I don't want to be treated like that.
Of course,
he did it to me before,
and nor should you have to be treated or put up with being treated that way. But I think Mike's got something going on where he can't contain his behavior. He really can't tolerate intimacy.
He's a guy. That's what he's got going on.
He's worse than a guy. He can't sit still with heavy feelings, and he has to push them away.
Because I guess his friend told me that he needed time by himself. And I said, that's fine. He can call me and tell me himself that he needs time alone. And I said, fine, I'll give it to him.
Right.
I'd rather him tell me that than put up a front.
All right, so let's just get to this real quickly. Let's just get to the bottom of this. You really like him, but you're angry because he hurt you by not calling for a week.
Yeah.
And you're scared that it's going to be a prelude.
Right. She doesn't want to put up with
things
this
to
necessarily.
come.
That's fine.
Well, he's done this to me before.
Well, you guys need to talk. You need to talk.
Yeah, we do.
All right.
I've been trying to do that.
Mike?
Yeah.
Call her up right now.
All right.
All right?
Thanks a lot, guys.
Good luck, guys.
All right.
Quit screwing up, Mike. That's my advice to all men, by the way. Quit screwing up. John, you're on Loveline.
Hey, how you doing?
Good.
What's up?
I got a question.
Mm-hmm.
I was recently going out with a girl who has this, something I had never heard of, papilloma virus.
It's called warts.
Is that what it is?
That's what it is.
That's just a fancy name for it, huh?
That's the virus that causes warts.
Okay, so unprotected sex, I can get this?
Correct.
Oh, boy. So I should be checked out.
Yeah, but actually, it's highly contagious. You should consider, even if you don't manifest warts, that you probably carry the virus.
Wait a minute. He probably carries the virus?
If he had unprotected sex with her.
Oh, okay. Is that what you did, John?
What's that?
You had unprotected sex with her, and then she told you she had HPV?
Is that what that's called?
Yes.
Well, you are really getting fancy here, Adam.
Yeah, well, once or twice, but then after that...
That's all it takes is once.
John, weren't you just a little bit pissed?
No, I'm not saying once or twice only. Even when I found out, it still went on, because the way that she explained it to me, it was something different. It wasn't like a... I mean, if she would have said venereal warts, I would have knew that, obviously, right? But it was some fancy name that I had never heard of. And so,
but, John, it is so common.
You thought it was like dandruff or something?
Well, she said it was like a cancer or some crazy.
Well, it does tend to predispose to cancer.
You feel like get her before she goes, right?
Well, boy, I'm in trouble then, because it was many, many, many times.
Well, but look, that virus is so common in people who are young and sexually active, you probably already had a version of it anyway.
Really?
I mean, it is exceedingly common. So it's not as though you have something unique. And you just need to wear a condom. You should wear a condom anyway.
Wonder if she told you she had AIDS.
What's that?
Wonder if she told you she had AIDS. Did you ask her if she had AIDS before you had sex with her?
Yeah, of course I did. And
or anything else?
Or anything else.
Well, this
AIDS
is
or
the
anything
else. Yeah.
Yeah, I mean, everybody...
Yeah, I knew this, but I didn't understand exactly what it was at all.
Here's the rule.
And neither did she, evidently.
Let me explain the rule to everyone who's listening when it comes to sexual contact with people you've known for under 5 years. When they say, I have something and you don't understand it, that is your cue to put a condom on. I don't care what it is, if you can't pronounce it, or if they just say, I have this, and then they start speaking Latin, you put a condom on. That's all you need to know.
Why would it be any different just than if you know you're going to have sex with that person that you put a condom on?
Well, I'm saying you
regardless
should,
of what they say they have or don't have.
wear a condom, but when you hear, I have this, when you hear that sentence uttered, you must put a condom on actually during the conversation. Even if you're eating dinner and they lean across the table and say, I have HPV, you go, hold on a second. Waiter?
I think a condom should go on until you know the person better and you find out more about them.
So is this something I need to go right away for, you think?
Why?
Well, I mean, can I cure this? Can I get rid of it?
No.
I've got it forever.
Correct.
If I have it, it's there forever.
Correct.
And there's nothing to do about it.
The warts should be contained. At least that's the prevailing theory. That if you get a bunch of warts, they should be treated because they tend to proliferate. It tends to be more infectious when you have warts.
Is that topical or is that a pill?
There's not pills, but there are multiple different topical.
But
treatments.
I think if we take it and look at it this way, if you look at it like having a pet that will never die, it doesn't make it so bad.
Right.
You know what I mean? It's like getting sea monkeys that will outlive you. John, does that ease the pain?
Well, my sea monkeys died, so.
I love the package, by the way. They have like the king one and the queen one.
They didn't look like that.
One of them's like running a carnival, a Ferris wheel and stuff, and then you see them and they look like they're little brine shrimp or something. They float around and the cat knocks the bowl over after a week. John?
So I've got a life with sea monkeys. Great.
Yes. Good luck.
Okay, well, cleared it up for me. Thanks.
Good luck, John. Okay. Speaking of sex, Susan.
Yes, I have sex.
Because we really haven't gotten into that with Drew. I'm moving away from Drew now. But I do have questions. You understand I have to ask.
Certainly.
Because
if
I don't... Yeah, okay. Not ashamed of that. Does he have a favored position?
No, but we like having sex because it doesn't happen very often because he's never home. He's always too busy.
So you're saying you don't have it with Drew very often?
No, never with Drew.
Drew's wondering why he's paying the bill for a pool man every year and they don't have a pool.
No, it's, I mean, of course.
All right, let's talk about, does he like to go and do, weird places and weird, elevators and laundry rooms and things like that?
No.
He never says, let's go traumatize the triplets by doing it in the crib?
No, but I do.
Oh, you do?
Oh, yeah.
Yeah, so that's my point. Women enjoy that stuff.
Well, I'm more creative.
Oh, you are?
That's what he likes about me.
Oh, he likes that you initiate this stuff.
I'm the bad girl.
Oh, so he does call you mommy once in a while, doesn't he?
No.
Yeah. Has you ever caught him mincing around in your panties? Let me give you a hypothetical. You said Drew, I'm going to go to the store and then I'm going to get my nails done and then we're going to enter a chess tournament. And you went out and you drove down the street and realized you forgot your pocketbook or something. And you came right home and there he is in a pair of frilly panties.
If I find you stealing my underwear again, here's what's going to happen. This is not acceptable.
That's what I say.
And did you know about any drug abuse or anything in college? I mean, did you ever hear about any kind of experimentation at all?
No.
Nothing? No, nothing that we could bust him on?
No. Isn't it sad?
You sure? You sure, Drew? You want to come clean?
When I was 19, I ate about 4 boiled peyote buttons and stayed up all night, but felt no effect.
Ah,
you did?
Yes.
No, I did not. I was telling a caller to say something like that.
Well, that's news. Did you know he had a drug problem?
Oh, no, I didn't.
You know, he gambles a lot, too.
Oh, yes, I taught him that, too.
All right, let's get back to sex before the well dries up here. How many dates? Seriously, how many dates before you guys did the deed? Because he's up here talking like, the Virgin Fairy. I was going to say Mary, but he's a guy. He's telling everyone to wait it out and all that kind of stuff. But I bet he was on top of you.
I totally disagree.
You disagree with what?
I totally disagree with that theory. If you want him to call you back, you have sex on the first date.
Really?
Yes. It was my idea. I made him turn the car around and go back.
You guys, first date?
Yes.
Are you serious? First date, because
I never lie.
You knew what you wanted.
Yes, I did.
There it was.
Yes.
You're a liberated woman.
He was driving me home. I said, turn this car around. You're going the wrong way.
You didn't grab the e-brake and crank the wheel real hard.
Pretty close.
And he turned the car around, didn't he?
And drove another 20 miles.
Did he slap the siren on the roof and do like 180? Like he do like a Rodney King thing all the way back to your place?
I don't know, but it was a fun ride.
First date.
Well, of course.
I don't think there's anything wrong with that. I mean, you knew.
Are you sure? I've heard the opposite on this show.
No, because you knew.
Ricky said, I hate to bring up his name, but I remember a conversation.
Bring up his name.
Is that okay?
Yeah.
I remember him saying something about how marriages never work if you have sex on the first date, or you won't get married if you have sex on the first date.
Right, and look at you two. You're miserable now.
We've been together for, 12 years or something?
Sure, because he's waiting for the second sexual experience. He keeps thinking it's coming. Maybe tonight. Hey, maybe tonight. It's Valentine's. Hey, anything before the show?
We're both going to be awake when we get home.
A little nookie? Any nookie before the show?
No.
Because Drew came in glowing.
I have 3 children.
Yeah.
I know.
Can't you lock? You can't just lock them in the room or anything, can you? All right, so let's move back to the sex here. First date, because you eyeball the guy at the gay bar where you met him, right? You know what you like, and you go out. You know he's a gentleman.
Well, no, we went out about 2 months after we met on the radio.
So it's kind of like you've been going out for a while. Like I did this with a girl once where we went out on 2 dates, and then she went back to Minnesota for a month, and then she came back and I nailed her in the airport. But we felt really good about it.
In the airport?
Right at the baggage claim. You know how you bend over to, with the carousel thing?
You did?
Yeah, I had to tip the porter. But no, would you go along with me for a second?
Gosh.
The point is we could tell everybody, oh yeah, we waited a month. When the reality is we waited 2 or 3 days.
We never dated. We just met.
You got right into it, and then that was it.
Well, it's my fault.
Right, because you said turn the car around.
I never believed in this, playing all these head games with calling or waiting for a call and waiting for a second date. And, I knew if I was attracted to a guy and we hit it off that it was going to happen probably eventually. And if I was going to wait, then he's going to think that I wasn't interested. And I really was attracted
right,
to
and you're a liberated woman and you're a sexual being and you know what you want.
Yeah.
All right. He never begs for a threesome, does he?
No.
Wait, he doesn't beg, he just asks?
No.
He just doesn't put notes in your cereal or anything?
I'm all the woman he will ever need.
All right, as far as you know. Now, let me ask something real fast while we're on the sex
You
thing.
found the dirt, I'm sorry.
That is good. That's good. But
it's my dirt.
It's kind of, but we shouldn't look at it that way because you guys have been together for 12 years now. Right? There's nothing wrong with that. All you did was get an early start.
An early start. It's not like we had sex before we went out to dinner or something.
You got to jump on sex.
Oh, my God.
You guys worked up a little appetite before you went to the restaurant. Nothing wrong with that. That's why he drives that station wagon.
It's after dinner and the drinks and all that.
All right, sure. Nothing wrong. He's no you know what he tells me all the time? He says, when I talk about dating and I talk about women, I talk about getting in the pants, he goes, juice them up and go. And he gives me a big thumbs up.
He does not.
He certainly does.
No way.
All right, let me just ask, and because I have to ask. We have to get to the size department. We do, because it was on the screen, and because I would be remiss if I didn't ask, is he small, puny, or microscopic? Which one is it? We're talking about penises now.
How tall he is, or what?
No. All right, let's go to girth. Just
his mind.
Let's go. Let's talk openly about penises for just 1 second. I don't want to ask this, but you got to realize I will be attacked if I don't ask the probing questions.
Well, but I don't think that's really.
No, it's not relevant. Not for me. Not at this stage of our relationship.
He's perfect.
Perfect?
For me.
Call him medium small?
He's perfect.
Smallish? Well, on the small side. Small, yeah. A little small, but perfect.
I didn't say that. He's
medium.
not small. If he wouldn't be perfect if he was small.
Okay,
and
because
he wouldn't be perfect if he was extra large.
You know, the average size penis is 3.5 inches, so you say he's about average?
God, I don't know. I don't measure it. He's huge. I don't know.
Have you ever caught him measuring it?
No.
Does he ever talk to his penis?
No.
Has he named his penis?
Pee on this stick for me.
Actually, I have. No.
Does he ever push it through the mail slot and wait for the lady to come bringing the parcels?
Adam, geez, have you?
Oh, hell yes. And
Why?
I live in apartments, so it's just people going down the hall that see
somebody
it.
did that to me once, but I don't think it was him.
Really?
Yeah.
They hung it through the mail slot?
No, they hung it through the window.
I've tried to get mine through the mail slot.
Why do guys do that?
Well, exterior doors are an
Scared
inch.
the hell out of me. I couldn't leave my house for a week. Jeez. I mean, come on.
He hung his penis out the window?
No, some guy did once when I was living alone.
Hung his penis out of your window?
In the window.
Toward you?
Yes.
There's.
Why do guys do that?
Maybe it was hot. Maybe he wanted to air. It could be a total.
I had to call the police. The police thought I was totally out of my mind. So there was a penis in my window.
Yeah, we got a 6900 going down on Elm Street. See the woman, seeing the penis. Really? So never anything strange. All right, real quick. Let me ask you this seriously, because every guy.
This is before I was married.
Every guy's done this. Has he ever went to the bathroom for just a moment while you're in bed, headed back in, took his penis and testicles, put it between his legs so it looked like he had just a vagina, and he said, "Come here, kiss Auntie Susie."
No,
he never said anything like that.
No,
nothing weird.
No, and I do have an Auntie Susie. That's not funny.
Oh, I knew.
She's a real Auntie Susie.
Okay, so nothing weird like that.
I hope she's not listening.
Never asked you to put anything strange in his butt?
In his butt?
Yes.
No.
I have to ask. Do you understand?
Well, maybe a gerbil or something.
The kids were like, "Where's the pet? What happened to our salamander, Ma?" "He's gone to a better place, son. Your dad will be passing him in a matter of hours."
Ew.
Nothing like that.
This is so weird.
Never asked you to dress up in anything strange?
Me?
Yes. Little something. Come on.
No.
Never wanted you to play, like, Tupperware party or nothing?
Not unless I wanted to.
Never played, like, meter inspector?
No.
Bible salesman?
Oh, God.
You ever tell him to put on his lab coat and use his stethoscope the right way?
He's actually a pretty normal guy. I taught him everything he knows.
Nothing weird. All right. Last line of questioning.
Okay. Make it quick.
Did he ever bring home, like, a cadaver and say, "Let's have a threesome"?
No.
Okay. Did he ever bring home any tools or anything from work? You know, any cheek spreaders or tongue depressors or you know, or carbuncle piercers or anything? No. Never brought home like a rag soaked in ether and tried to force it on you?
Just his wonderful self, that's all.
Does he ever bring home any sample pharmaceuticals and say, you know, let's nothing?
No, unfortunately.
Does he ever leave the toilet seat down or up?
No, he puts it down. I make him do that.
How did I learn that, though?
I had to train him.
Yeah.
During pregnancy. Took pregnancy.
Oh, I fell in the toilet.
You fell in the toilet?
I was pregnant with triplets, and I fell in the toilet. I was so mad at him.
Because you're carrying around a lot of weight, and once you start that downward momentum...
Oh, I was mad. I said, "Drew, you know, I'm pregnant with triplets. You got to put the toilet seat down," because I fell in. Because I got heavy.
So you train him for that?
I had really strong legs, you know, but after the 50 pounds were in my tummy area, I couldn't hold it up.
Any weird grooming habits? Anything? Does he trim things in a strange manner?
No, he plucks his eyebrows right in the middle sometimes.
Right in the middle? Well, I do that too, otherwise I'll look
Is that
like...
weird?
Well, I'll do it, so I can't say anything. I'll look like Matt Dillon in his tri-brow if I don't.
Do you plug
if I don't
any?
do that.
I know you shaved your butt.
I
heard that one.
Let's stick to Drew for just a moment here. Has he ever shaved anything weird?
No.
Nothing.
No.
Any way he applies aftershave that we need to know about?
No.
And no talc? Does he talc up? Has he been listening to me with the talc down the shorts?
No.
Does he ever wear underpants more than one day in a row?
No. Unless we're on a ski trip or something and he runs out.
Do you ever catch him just wallowing in the hamper like a dog rolling around on a lawn?
No, we have people who do the laundry. And it's not me, thank God.
Does he pee?
He's great.
Does he pee in the shower?
Well, I asked him that because the cats were peeing on the carpet outside the shower once, and I told him to stop it, and he did.
He pees in the shower.
Yeah, he said
Kitty
he did.
see, kitty do. Has he ever taken a dump on the glass coffee table in the living room?
Oh, yeah, he did once,
All
actually.
right, now we're getting somewhere.
Hi, this is Victoria Paris, and you're listening to Loveline with Dr. Drew and Adam Carolla.
Oh, I'm a tremendous fan of her work, and she has quite a large body of work. Porn star Victoria Paris there. Phone numbers 1-800-LOVE-191, 1-800-568-3191. Fax number 310-854-4455. We're here with Drew, who took his grilling like a man, I must say, and his lovely wife, his foxy wife, his more than attractive wife. Attractive is what you call average-looking people when you're trying to be polite. She is foxy, and I can see...
Thank you, Adam. Thank you very much. I appreciate it.
I know. I can see why any woman would be attracted to Drew, but I can see...
You're working it, aren't you?
why he assaulted you on the first date. Now... I see what it was all about. And let me just read this fax. Just wanted to clarify...
He didn't assault me.
...what transvestite training is. Anything a dominatrix does to their submissive is called training, meaning they're submissive, I guess, their partner.
So transvestite training must mean that it's somebody, they're dominating a transvestite.
Right. Therefore, if a guy thinks he might enjoy being dressed up as a woman, as Drew admitted to earlier, if you didn't catch that, a lot of people weren't listening, he hires a dominatrix to train him. In other words, slowly to acclimate him to cross-dressing. Might start out with a woman's underwear and progress to dresses and wigs and makeup and etc. Eventually, you become what everyone's grandmother looks like, I guess. Because what people's grandmothers look like is kind of like ugly guys in drag, if you really think about it. Just happy to help out you guys. Scott in Brentwood. Well, we thank you for that little ditty, Scott. Now let's go back to the phones. Paul.
Hi, how you doing?
Hi, you're on Loveline.
Thanks. Well, I was recently dating this girl, and well, when I wasn't doing anything that day, well, I just went to the movies with a couple of my best friends, and so when we were seeing a movie, I saw her and this other girl kissing.
Mm-hmm.
Weird.
Mm-hmm. You saw, wait a minute, you saw her and another girl?
Yeah, it's kind of weird at this age, you know.
Hey, how old are you, Paul?
13.
How old is she?
14.
And were they really making out, or because girls can be more affectionate, at least in public, than men? They're more comfortable with it, and sometimes it will embrace or give a peck on the cheek or something like that. It doesn't mean it doesn't mean it's in a sexual way.
Yeah, well, it was kind of dark, and because it made me feel really weird.
Well, was it in a sexual way? Were they making out?
Well, they were. I saw like two heads there, like shadows, and they were there for like 5 seconds. It was, you know, I couldn't say anything to my friends. I just saw it, and I just, like, you know, freaked out.
So Paul really sounds upset about this.
All right, so Paul, we'll just go along and say that this actually happened and take it from that point.
Right.
Okay, so this is a girl you had been dating.
Yeah.
And who you felt some pretty strong feelings for.
Yeah.
Much like the feelings that Susan generated for Doc Drew after only the first date. So Paul, you think she may be, well, I guess bisexual now, if you can be at 14, if you can establish that. Drew's shaking his head no.
That's what I think kind of weird.
I think you shouldn't jump to any conclusions. I mean, you really don't.
I think that it's nice how she finds, love with another person.
Right.
But we were going out, and of course I'm not jealous or anything.
Why not?
Because it's weird. I mean, I am kind of jealous.
You don't know if you should be jealous or not since it's another girl.
Yeah.
Right. Look, why don't you give her a chance to tell you about what she's feeling?
I'm afraid to talk to her about it because I don't want to,
I can understand that you would be, but I think you need to because you really, first of all, don't know really what you saw. Secondly, part of what you're upset about is that she's doing funny things and doing things with other people when you think you guys are kind of together.
Yeah.
And then thirdly, you wonder what her problem is with her sexual identity. Is she gay or what? What's going on with her? She's so young, and why it's making you upset and feel weird and wonder about what her intentions are with your relationship. I think you got to give her a chance to talk about it. Okay?
Yeah, that's what I should do.
Paul, confront her in not a confronting way, though. Just bring it up as best you can, discuss it with her, and figure out what's going on before you jump to too many conclusions. And it's funny how cheating sort of runs the gamut, meaning at the top of the cheating list is your girlfriend getting it on with another guy, or if you're a girl, your boyfriend getting it on with another girl. But then there's all sorts of shades of gray beneath that, you know what I mean? Then underneath that is probably having a same-sex type thing, which guys would not look at as bad as another guy being with their
but for
girlfriend.
13-year-old, he doesn't know what to make of that. It just makes him feel weird and overwhelmed because it
right.
doesn't fit his sense of who she is.
And for a lot of women, it keeps going down into other shades of gray, which is like finding a Hustler magazine under the bed or something like that, you know? So it's like there's overt cheating, and then there's sort of grades of cheating. But everyone seems to have draw their own line. Mine is a little above the part about having sex with someone else. Alex.
Yeah.
You're on Loveline.
Hi, how's it going?
Good. How you doing?
I'm doing pretty good.
Fantastic.
Well, I had a question. I wanted to know. It was kind of funny that you guys mentioned that the doctor's wife is very attractive, because that was what my question was. How important do you guys feel physical attractiveness is?
Well, the doc is going to sit here and do a skin-deep rap, and he was attracted to her brain, but that does not explain why he attacked her on the first date. And it was essentially she could bring him up on charges, although I'm not sure about the statute of limitations at this point. But I think you could get a good lawyer would get you something out of this. Yeah, so he's going to pull that rap, like most guys do. But let's face it, guys are attracted to physical beauty. And how important is it? It probably has to do with how secure you are. The more secure you are, the less important it is, and vice versa.
What is your situation? Why are you asking this question?
Well, I've been listening to this show for about a week, and I was trying to think of something to ask. And actually, your voice, I was imagining that the doctor's wife is actually, she seems quite attractive, and I was wondering if it was true. But that wasn't really my question. That was why I thought to ask it.
Well, she is, and I think men, unfortunately, are much less evolved in this department than women are, because women can be attracted, and it can be in a sexual way, to guys based on sense of humor, based on more things that you would have to do with personality, what you would call personality traits. Whereas guys, if Squeaky Fromm looked good in a party dress, then we would have her paroled and be on top of her in a second. That is a Manson reference there.
Yes, I know.
The point is guys don't really care about the personality. Later, they do.
Well, I do care about inner beauty and all that, very much so. But I feel like a person that has both the inner and the outer beauty is kind of rare.
Right. Inner beauty is great, but if you have to cut through a big, thick, ugly skin to get to it, then it's rough.
Or there's beautiful women that have nothing inside, or
right.
good-looking guys.
I went through that last year.
You have to just go through it. I mean, I dated guys that were good-looking but total jerks, and or I dated guys for a long time that were good-looking to a certain degree, but had a great personality. But, I was lucky with Drew because he was really gorgeous and really smart and really wonderful, and I ended up with him. I used to see beauty everything that I did as a job. I mean, I was working as a model. I had a group of models working for me, and Drew was attractive. I could tell he was attractive, but I also knew he was intelligent, and he was well-rounded and very nice.
Right, the total package.
I mean, it's really hard to find people like that, but I was really lucky, and and a lot of people don't like to say that they chose their partner because of the way they looked, and I'm not perfect. I mean, Drew, loves me for who I am. I was probably pretty when he met me, and as I get older, it gets worse and worse. But
baby, don't say that.
But it's not really important if you're happy with your person, your love of your life. I mean, if it's your soulmate or somebody that you want to be with for the rest of your life, it doesn't matter what you look like.
And I can say this, even immature guys can eventually be attracted physically to a characteristic, meaning you can see someone, everyone knows the story, you see someone, you think, they're okay, but nothing big, but then you get to know them a little, maybe they're a friend of a friend, maybe they're in your clique, and you hear their rap, and you see the way they treat their friends, and you see their talents and what they're into or their sense of humor, and you start getting more and more physically attracted to someone based on that, although women are much better at that than guys. Shauna.
Hello.
You're on Loveline.
Hello. How you guys doing?
Well.
Okay, I have a couple questions.
Yes.
Okay, I have a lot of gay friends and stuff, and I'm not gay, but I've been having dreams about having sex with women, and I was wondering, am I gay or something?
No.
Would that mean?
That doesn't mean you're gay. Maybe you have those kinds of homosexual feelings or even tendencies, but it doesn't mean you're gay.
Uh-huh. And I told my friend Amanda about it, and I think she told the girl, and now I think she wants me, but when I have dreams about her, but yet I don't like her.
Shauna, relax. Don't get forced into anything. Don't do anything you don't want to do. Don't assume just because that person is aware of some kind of vague attraction you have for her, she's going to be able to suck you into a relationship or attack you in some way.
Mm-hmm.
Not going to happen.
And let me tell you, as you get older, you learn to ignore your dreams because you have them every night. They make no sense. I have dreams where I'm leading a group of French liberators into Nazi Germany to free Jabba the Hutt. And this is a reoccurring thing, but I just have bizarre dreams. I have bees. I had dreams my dad tried to kill me a few times for talking too much in front of the TV set.
That's actually a real common dream.
Yeah. Is my dad or anyone's dad?
Anyone's dad.
Because everyone's having it about my dad, then we got to look into that.
Got a little bit of a problem.
But the point is everyone has weird dreams, and all right, I'll do this after the commercial line. Everybody has weird dreams, and you cannot pay attention to them.
Mm-hmm.
All right, next question real fast?
That's all I had.
You know what? Can I say something about dreams?
Yes.
If you look back 2 days, sometimes you can trace your dreams back about 2 days. So something that happened to you 2 days before. You might have seen something on TV or heard something on the radio.
How'd you know that?
We're talking.
How'd you come up with that?
Because it usually takes a couple days for your subconscious to
That was Freud's theory. That was his theory.
That happens to me
hours.
all the time. If a couple days go by,
Yeah.
And I have dreams about what happened 2 days before, and I try to put together all the things that happened 2 days before.
And they're usually vague symbolic references from 2 days before.
2 days after you had your first date with Drew, did you dream that a dog had attacked you in the park and dry humped
your... dreams.
Okay. We'll be back. Phone number 1-800-LOVE-191, 1-800-568-3191. Fax number 310-854-4455. The show is called Loveline. I'm called Adam Carolla. He is called Dr. Drew, and she is called Mrs. Drew, Susan, who's here tonight dishing all kinds of dirt on Drew, loosening up a little and having a good time. And I think our listeners appreciate that because they listen to Drew week in and week out, month in and month out, year in and year out.
And nobody knows my problems.
We don't care about your problems.
Well, I have problems, though.
But we don't care. We got to talk about
Why?
it. Unless
it's your fault, Adam.
Unless the problems Drew gave you.
He gave them to me.
Like crabs? What do you got?
Well, like I'm always alone, and I have to take care of the kids every night when he comes on the air, and he works 3 jobs, and he's an overachiever, and, he's a great guy, but, there are the downsides of that.
By the way, overachiever is not a good term. Overachiever means dumb guy way over his head. Doing way more than he should have, accomplishing way more than he should have accomplished with the brains God gave him. I think,
no,
but I know how you meant it.
Is that what that means?
Well, not really, but sort of. I would say Drew's achieving about as much as he should achieve given all the tools that he has. I don't want to nitpick.
And then, it's been going on for years and years and years.
And you're lonely.
Yeah, and I have 3 kids, and
you
I'm
have
raising
needs.
them. And, oh, sure.
And you're in your early 30s now.
Well, yeah.
Yeah, okay. That means late 30s. No, seriously. You don't look a day over 39.
Okay, all right.
You really don't look a day over like 32. You look very young. You've stayed out of the sun. Oh. I guess you kicked the heroin thing some years back, and you look really good. And the point is as you get older, and I'm guessing you started off a little horny in life. You don't have to answer because we don't need to shame you or the doctor here.
It's not that I'm like oversexed or something or undersexed or whatever it would be. I'm just basically alone most of the time.
Right, and
I'm raising 3 3-year-olds.
You're a woman and you have needs.
Right, and I spend most of my time with the nannies or the grandparents and the kids or. Driving between the gym and the market and nursery school.
And as good as the doctor is, he's still
I have a great life. I live in a nice house. I'm a very happy person. But
right.
It's like
it's
like
hell.
being a single parent.
It's a living hell.
It's a single parent with...
It's hell.
Yeah, it's busy.
It's hell.
It's lonely.
It's a busy, chaotic hell. And I was going to say, as good as the doctor is, he's still not figured out a way to remove his penis and leave it at home when he goes out for one of his 18-hour days.
I need that.
See, I worked that out, but I ended up losing it. So I'm going to go out to the car and look under the seat.
And you know what it is? It's not just the sex. It's like having the time to. Women need time to get into a sexual relationship or have the nurturing.
Right.
And just having somebody around to. He's great. He comes home and he rubs my feet. It's really great. After a long day, he comes home and he rubs my feet.
Wow.
And that's like the greatest thing,
Yeah, but you want that time before to build into the sex.
Yeah, but then, he leaves at 9:30, so the sex, isn't as often as we'd like it to be.
Now, essentially foreplay is Drew saying, come on, pull your skirt up, baby.
Or we're too tired, on the weekends. We're like, oh, my God, I'm so tired.
Has he ever fallen asleep on you? Yes.
He's tired, too.
Right.
He works so much.
That's what I'm saying.
Yeah, but we go away and we try to take vacations, but, it's really, you have to be really strong. You can't be clingy, and you have to just be able to bear through it.
Right, but once you get out of town, once the bags drop in the room and the door gets shut.
It's fine. As long as we have a nanny with us, if we have our kids, we have to get a completely different hotel room for the kids. And if we go away alone, which we're going to actually do for our anniversary.
You can't leave them in the car?
No.
Even if it's not too hot?
So, it's pretty tricky.
It's just a big...
but most parents go through this. I mean,
it's a free-for-all in that room, though, once you guys get alone. I mean, it's like freaking Woodstock in there. Am I right? Yes, the clothes flying from every direction.
Yeah, it's usually pretty good.
Drew ever fog the glasses up?
Well,
right.
I don't think he wears them.
Quick question. He ever put the glasses on around his waist so his penis becomes the nose?
No, what are you talking about?
Never does that and then puts like an oversized top hat on.
Adam, jeez.
Never. Okay, I have some quick penis questions.
More penis
questions?
I
don't want to ask them,
you know what?
but I did get a fax.
Penis questions.
I don't either, but you understand I have to ask.
Oh, no.
I got a fax. It says compliments me on getting to some of the hard-hitting questions, but said we left the penis query too quickly. We've yet to find out if the good doctor is circumcised.
Yes.
Yes, okay.
Oh, why are you prompting me? I don't know if I should be answering
Don't be prompting, Drew.
Drew told me to answer that. Okay,
Drew,
yes.
put your hands by your side. Whether it bends to the left or to the right, and I guess it depends on what side of him, if you're standing in front of him or behind him.
No comment.
No?
I don't
no
know.
pull?
I have
no pull one
idea.
way or the other?
It's perfect.
There's no English on that weenus?
I have no idea.
Okay, so you're saying straight?
Yes, but, I don't know.
Like the crow flies?
I can't tell you.
His penis goes like the crow flies.
What difference does it make? I mean, is he going to win an award or something?
I'll tell you what difference it makes. Inquiring minds want to know. Our sick listeners are interested. Why? I'm not interested in this. Do you think it's for my own pleasure?
It's for your own pleasure, I'm sure.
No, it is not. This is a fax. Do you hear that? Okay, let me ask you a few more questions. Does he wear it to the left, the right, or the middle? When he's wearing
no idea.
Well, when he's wearing slacks.
I never look.
You don't look?
No.
Drew, you want to jump in on that?
No,
right,
he doesn't.
I'm guessing he goes down the right foul line.
I haven't
for
really
that one.
thought about it.
Okay, oral sex. All right, I'm sure he's into that. You just nod on that.
Oh,
he's
sure.
He's into
Everybody
that.
is.
And he's a giver,
Yes,
too. Oh, yes.
extremely
He
good.
knows what a woman likes.
Oh, yes.
Does he take the glasses off? Does he have the decency to take the glasses off?
Of course, and he shaves. Okay,
he
let's
shaves.
go.
Does he ever do that little
Not his
reflective
head.
mirror that doctors wear just to really...
No.
never does
And
it.
he knows where the G-spot is.
Oh, he does?
Yeah, so keep going.
Okay, because wait a minute. I'm going to find out what that is in a minute. Innie or outie belly button?
He has an innie.
Does he have a third nipple?
No.
Okay.
But I do. No. Remember, I had 3. I had to grow another breast.
Oh, right. You got triplets.
Right.
All right. Well, that's it. Sincerely a gay fan. So there you have it.
Okay.
All right. We're going back to the phones. And I thank you for your sincerity and your frankness. Jim.
Yes.
You're on Loveline.
What's up, Adam?
How are you, Jimbo?
I'm all right. How are you doing?
Oh, I couldn't be better.
Interesting show tonight.
Thank you.
I just, my problem here is I was going out with this girl, and I went out with her for about a year, and we're supposed to get married in July, right?
Right.
And about 2 months ago, she starts freaking out on me, starts saying she don't know if she's ready to get married, blah, 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 needs to date other people, whatever, you know. And I'm like, the whole time I'm just going, well, she's just got cold feet, whatever, you know. So I kind of backed off, and she started dating this other guy, right?
Mm-hmm.
Like the week after, the day after I moved out.
Don't think that he wasn't lined up.
Oh, I know.
Well in advance of the time the starving student showed up with the van.
Yeah, so anyway, the problem here
Signaling to the bullpen, by the way. Yes,
Yeah.
calling it a relief penis. Yes, Jim.
Oh, man.
It hurts, baby. I've been
The problem
there.
is here, okay, about a month goes by, and I'm just aching, man, the whole time, you know. I'm like doing the whole, you know, okay, I'm going to feel this now and not feel it later.
Hey, you doing any stalking?
Huh?
You doing any stalking?
What's that?
That's where you follow her around?
No.
Not parked out front of her house?
No, I'm not a stalker.
None of that? None of that get loaded and busting the house? Goddamn bitch, I left my chapstick here 6 months ago. Where is it? I need it.
No, I didn't want to deal with that, so I left it alone, you know, and let her do what she was going to do. And then I started dating this chick that was 18, right? Me and her were 24, and then
Right.
I started dating this friend of mine.
You went younger.
Yeah, she's
Right.
only 18, and,
Right.
and she's great, man. She's beautiful. She's, you know, going places. She's going to New York next semester for school, and so she's not in the picture permanently.
Mm-hmm.
But my problem is, like, I'm starting to really like her, and we're starting to, like, get you know, it's getting to the point where we could, like, be having sex anytime now. I've been holding back. I haven't been, like,
Oh,
trying to get
well, that's refreshing to hear.
You know?
Unlike some other people.
And so...
Surprised they're not doing it right here in the console.
So, you know, now the problem is my ex is calling me, you know, and she's starting to, like, feel all this pain and, like, wondering if we could have done something to work it out. And then it throws my heart in two, because I'm like, well, part of me is going, well, you know, I wanted to be with her, and I wanted to get married to her, and
Yeah.
now I'm with this other girl.
All right, Jim. Susan's going to help us on this, but here's my take as a guy. I would write the ex off because I don't think you're going to be able to forgive her anytime soon for this situation. You may say, I forgive you, and then one day you're going to start talking about something, and she's going to go, what kind of dressing should I get on my salad? And you're going to go, Thousand Island or French, and then you're going to yell, well, at least I'm not banging guys behind your back! Oh, God, no! You're going to work that into every conversation. Do you understand?
Is that how guys are?
Yes, they cannot let things go.
Really?
They can't.
But
They
women
can't let
can.
it go. Women can.
But see, this is the deal.
Because they're smart.
This is the deal. She's calling me, asking me questions about this other girl because she knows I'm dating her.
Damn straight she is.
Asking me where we, you know, how often we see each other, where do we go, what do we do, like, you know, just probing me in roundabout ways to get all this information, and I'm like going, well, what difference does it make?
Right.
You know?
All right. She doesn't sound mature, and I'm not here. I don't want to just, commit acts of misogyny on the air. I'm not here just to bash her because she's a woman, but I am here to say that she left. You know, you guys were living together. You guys were talking about getting married. She was your fiancée, for Christ's sake.
I was going to take her to Jamaica in July,
you were going to take her to damn Jamaica and home, I'm assuming.
Yeah.
Yes. The point is she moves out and starts up with a guy immediately and starts right. She works with the guy. Okay. That's what I needed to hear. I say it every time. They stalk their prey. Do you understand? They're like cheetahs up in a tree.
The supervisor. Oh, great.
Okay.
So that's not going to work out.
This isn't going to work.
And that's why she's back at him, because the other
right. It's not working out. Now she's coming back. Forget it, Jim. Forget it. You got
I like to hear you, Dr. Drew, man.
I've been kind of quiet
all night.
I sure have.
He's been put in his place. That's why.
Well,
I've been hiding under the table here.
I think Drew and I have different ideas about this. I think we think differently on this whole subject.
Why are women so evil, man?
No, Jim.
But Jim,
please,
actually, you
there.
sound like a reasonably healthy guy, and you've got this new relationship, and you'll be able to enjoy it, and you're going to explore other people.
Right.
Take your time, live your life.
Work it out with Lolita.
Yeah, there'll be other people in your life that'll come through, and I'm sure you'll look back and see how, thank goodness, things worked out the way they did.
And if you do go back with your ex-fiancé, make sure you give it time before you get totally involved to the point where you're going to get married, and make sure you can trust her, find out what happened. And, you know, I'm not totally against going back with her.
I'm not either. I'm not either, but I don't think it's a good idea.
I forbid it, and I put a curse on anyone who takes her. You know, we have a fun time here on Loveline. Beautiful phone op Sherry and beautiful producer Ann. We're having a lovely time at Dr. Drew's expense tonight, learning about all sorts of things, all sorts of dirty little skeletons that Drew had in his closet. And it's really a compliment to you, Drew, because, and Ann, you can chime in here if you like. If Drew was a fat, repulsive, disgusting tub of a man, you would not give you would actually be repulsed by hearing these stories, by
stuff like this makes me sick.
Hearing these little sexual revelations, wouldn't you, Ann?
Definitely.
But it's because...
But it's okay when it's Drew.
When it's Drew, because look at him.
Yeah.
You know what I'm saying? He is a god.
He's a god?
He's a god. He's like Adonis and Patrick Swayze.
There's just got to be some more dirt on him. He can't be that perfect, Susan.
I know, it's hard, isn't it?
All right, we have about 50 seconds, Susan. Is there anything, has he ever had, to the best of your knowledge, and just hypothesize here?
If you'd like to write to us or ask any of these lovely questions, it's Loveline, P.O. Box 4345, Hollywood, California 90078. Email at luv191@AOL. And we'll be back tomorrow. I suspect I will be back tomorrow.
Have you ever caught him chasing a chicken around the house,
no,
yelling, "Give me some
perfect.
sugar"? Never.
And I appreciate him letting me come on the show tonight, and you as well.
And we appreciate having you, Susan. And we hope to see you. Well, we'll see you before next year, but hear you next Valentine's Day show.
And I hope my kids are okay, and Nanny Rena is having a fun time tonight.
I'm sure they're in one piece. And I want to say that Barry Nolan from Hard Copy is going to be on tomorrow night, and we can talk more about dirt. Until then, I'm Adam Carolla.
And I'm Dr. Drew.
And we'll see you tomorrow.
So that's it, then. The opinions expressed on Loveline by Adam Carolla, Dr. Drew, or anyone are not necessarily ours. Be happy, be happy, 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 happy. Loveline's producer is Ann Wilkins. Thank you.